Good afternoon. I'm Dr. Karen Andre, and today we're going to cover part one of 5 parts of a discussion on COVID-19 helps to increase your immunity, increase your resistance, prevent infection, possibly, and to, if you do contract the infection, what are some things that you can take to mitigate the inflammation that causes the harm by the virus to your lungs and kidneys. So today we're going to cover the diet. Now, why would we talk about diet, lifestyle, as well as supplements and specific things? Because the most important thing you can do if you don't have COVID virus now is to make your body as anti-inflammatory, number one, and number two, improve your resistance as much as possible. And there are some real things that you can do. Before we start, I want to encourage you that to take this information and sit down with your family and have a family conference with your children and teach them these things. Then think about some ways you could encourage each other about incorporating those things into your life. And then at different times have family powwows where you're praising each other and encourage each other to do better and reminding each other. Because it's real important during this time that we stay connected socially and we help our families and we keep calm and not panic and have a positive attitude to do the things that we know will help us do better in either resistance, by improving our immunity, by helpful protection, by resisting infection, and then if we do, if we do contract it, what would be the things to make the best outcome from that? So today I'm going to talk about diet, and chiefly it is an anti-inflammatory diet. So I'm going to go to the whiteboard here and I'm going to write some categories of basic things about an anti-inflammatory diet. Now, there's so much on the web about this and so easy for you to find, so I'm just going to touch the main things on this. So number one, you want to avoid 3 things. You want to avoid overuse of gluten, and that's in wheat products. You want to avoid sugary things, and we're going to touch on, I'm going to put a star here, because we're going to touch on some real important things about how to keep your blood sugar level, because the skyrocketing up and down of sugary foods, what it does to your blood sugar, makes you more vulnerable to the COVID infection. So we'll come back to that, but that's an important thing to avoid. And then you want to avoid processed foods. And if you have a leaky gut, or if you're overweight, or if you're sedentary, or if you have any serious chronic disease, you want to avoid the overuse of pasteurized dairy. That's a topic for another discussion, but the pasteurized dairy is inflammatory. So the exception to this that we know that is good, and so I'm going to write exception, would be Greek yogurt. Alright, now I'm not talking about the yogurt that has fruit flavor in it, because that has a lot of sugar. I'm talking about plain. And if you can find it, you want yogurt that is full fat, not non-fat. That's actually better for your blood sugar levels. So, furthermore, what do you eat? So, now I'm going to take this off and I'm going to put what are the things that you do eat for a anti-inflammatory diet. Number one, you want to eat foods that are as close to the way they came out of nature as possible. So you want to eat, that's easy to remember. So what kind of foods do? You want to eat a lot of vegetables, and fruit. So for the vegetables, you want a green every day, a dark green preferably. You want reds, yellows, oranges. Again, so you want a rainbow on your plate. Those are really important. Now for the green vegetables, here's some caveats. You want to avoid over juicing, and some people juice, so I mentioned this, over juicing of raw dark green. And the reason you do that is dark green things such as especially spinach has a lot of oxalic acid. And the oxalates, when raw, can decrease your serum calcium, and also in very high amounts they can cause optic atrophy and decrease your vision. So you don't want to overdo juicing of raw greens. Steaming green vegetables, that's wonderful, and you want at least, if you could have 2 or 3 a day, that's even better. Red and yellow vegetables, and the number one vegetable, the number one food in our diet that has the highest amounts of vitamin C is red pepper. Now, a lot of peppers are inflammatory, and I'll talk about that. Fruit, and in your fruit, you want slow release. Number one, the highest antioxidant fruit are berries. And so, blackberries, blueberries, boysenberries, raspberries, all of those berries are high in polyphenols and are rich in slow release sugar. Strawberries have a good red color, but in abundance, they are in a family called nightshade, which is one of the other ones I'll mention to avoid for some people. But so you want to do berries to a minimum. So the other thing you want to do is whole grains that aren't particularly wheat. So wheat-free. So quinoa, rice, black beans, and then slow-release carbohydrates. Again, rice, sweet potatoes are healthy. Any slow-release, non-gluten, real parsnips, carrots, those have slow-release carbohydrates, and that keeps your blood sugar level. The other thing you want to have now is we're going to talk about protein sources. It's really important that you get your protein sources from, as much as possible, you want healthy protein sources, and the key word for that would be grass-fed. So what does that mean? It means that it comes from a farm or straight from the pasture. They're either from their mom to the pasture to the processor. You want to skip the feedlot, because once they hit the feedlot, they're full of antibiotics and their omega-3s drop. So grass-fed beef, chicken, lamb, goat, those are all good. Turkey, grass-fed. Now number 2, fish. What kind of fish? Fish should be the staple, so I'm going to put, that's even more important than these. So you want deep sea wild caught fish. Tuna, cod, salmon, sole, bass and crappie. I'm from Texas, and so we have a lot of fishermen, and bass and crappie are fine. You do not want catfish or shellfish. They're inflammatory. They don't have scales, and they concentrate heavy metals, and they're just inflammatory. Furthermore, you don't want pork. So for your bacon, you want to get turkey bacon. Pork is inflammatory. Besides, they carry some diseases. Now we have some trichinosis cases for which we don't have good antibiotics. So grass-fed beef, good bacon, and also mackerel and is another type of fish you can get. Your deep sea fish. Now, the other fish that you want to stay away from is grain-fed or farm-fed tilapia, or any farm-fed fish. People know that fish are good for you, so there's a lot of farms that grow it, but you want to stay away from that because it's not high in omega-3. So the key for the grass-fed is you want to keep your omega-3s high. So the third category that you want to eat for positive would be nuts. So pecans and walnuts have a high amount of omega-3. Now, they're high in oils, so if you're watching your weight, you want to make sure that you don't eat too much or think that, well, I'm going to eat a lot of nuts to keep my omega-3s up. So you want nuts in a reasonable quantity, a small quantity, but a fourth a cup of nuts, pecans, and walnuts have the most. Peanuts really don't have that much. If you're going to eat peanuts or peanut butter, be sure it's the natural kind. So nuts are healthy in omega-3. They are too, but be careful for that. Selenium is one of those minerals you need. Brazil nuts have selenium, but you just watch that. Now, so for some other things to avoid and some other things to put in your diet, the one thing you want to avoid are, we said sugar, we said wheat or gluten, pasteurized dairy, and the exceptions I said are lacto-fermented Greek yogurt. There is a cheese called Gouda that actually will help raise your probiotic levels, so that's a good cheese for you. And the other thing is a group of vegetables called the nightshade family. Not everybody is sensitive, but many people who have trouble with chronic diseases, arthritis, obesity, or anti-inflammatory, auto-inflammatory diseases, rheumatoid arthritis, lupus, scleroderma, chronic fatigue, these illnesses tend to respond to nightshade and they make them worse, and they make us more inflamed. So what are nightshade? Now, I'm going to give you some basic nightshade families, but again, you can find this on the web quite easily. So nightshade would be tomatoes, potatoes, peppers, and strawberries. And then eggplant. So these are nightshade. A good way to test and see is you could do without them for 1 week totally and see if you feel better. If you have some arthritis or you have some joint issues or some fatigue, you will notice within about 2 weeks, 1 week to 2 weeks, that you're going to feel better if you omit the nightshade. So one of the things that we love around here a lot is salsa. And salsa has tomatoes and peppers a lot in it. So just don't have salsa every day. Just be careful with it. So it's just one of the things to remember that you want to avoid. Now, I've just noticed I've done a couple of things that you have to stop doing during COVID, and that is touch your hands to your face. So we're going to talk about that in a minute, but you want to avoid doing that. And as I think about it, you have to think about it and think about it yourself. Now, the fruits that we want to talk a little bit about is sugar. What sugar does to the effect of sugar and blood sugar levels, and specifically blood sugar levels on diet. And I'm going to end this talk on diet because this is so important. I'm going to go a little more rapid here because we don't have so many more minutes for this. But clue into this. This is the good take home for today, besides knowing what an anti-inflammatory diet is and using it. And if I don't have time for it, we'll put this on part 2. So it looks like we're not going to have time for it. So we'll end today, and our next topic is what does a blood sugar level do, a drop in blood sugar level,